Oh, that's a bit too zoomed in, so we're gonna zoom back out a bit again. Right. How do you keep your team calm in the operating room when complications arise?
Every operation, as I sort of define with patients, routine surgery is essentially when I take someone to the operating room and the hard parts of the operation are hard and the easy parts of the operation are easy, and there's no surprises. And ultimately that's what we want for our patients. A routine surgery where they come in, the easy parts are easy, the hard parts are hard, allows the patient to get off to a fast start with their recovery. But there are definitely times where in the operating room you come to a challenge that was not anticipated. Either anatomy is more difficult or the patient's more scarred into some spots, and that's where you just have to sort of buckle down, let everyone know that you're coming to a spot that's a little challenging, and make sure that people are sort of cutting down on the casual banter and the other things that most operations will have.
When a patient Googles something like an aortic dissection, there can be a lot of anxiety over the results that might pop up. How do you allay their fears and some of the misinformation?
Sure. So I think the one of the prime goals of myself as an academic surgeon or other members of the Miller-Colson Academy is to publish our results. Ultimately, there is some real trash in terms of quality data out on the internet. By publishing our results, having people go to those papers, go to our websites here at Hopkins and get solid data is really the first step. So many patients will come with information that's probably a little bit overcooked in terms of threats towards their life or their livelihoods, and so we really have to start by just going through their history carefully, introducing them to the subject of aortic dissection slowly. And the fact of the matter is that many patients with aortic dissection, once they get through their first operation, might never require another one. And so in that way, sometimes it's actually an easier conversation to say all of this doesn't apply to you. You've had your first operation, and now here we are. We're going to manage the medical side of things, control your blood pressure, help you with your cholesterol. And once we do all those things, a lot of the other downstream effects of aortic dissection will never come to pass.
You've found that some of your greatest experiences as a surgeon are when telling a patient that surgery isn't necessary. What is that feeling like?
A lot of our patients will just require surveillance, and some percentage of them year in and year out will come to require surgery, but that isn't the case for most patients. And so perhaps this stems from misinformation, bad experiences in the family. They will come in and you can see them right from the door as you walk in that they are cranked up, stressed, and those patients usually we start by just going through the information, backing down some of their anxieties, and ultimately a lot of the stress comes from the fact that they know they're going to have to interrupt their life, they're going to have to interrupt their family's life to help support them or in the hospital or going through the recovery, which could be weeks to months, depending on what they have to do. So once we sort of get to that level, you really see the patient's concerns, emotions, anxieties start to relieve. Now they know that they're in a space where they don't need an operation, and for that matter, their family doesn't have to worry about them having an operation, which is sort of the icing on top of the cake.
Dr. Black, thank you very much for your time.
Sure.
That was a CLOSLER Look.
All right, thanks.